Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidence in successful studies in 2014, 2018, 2022, and current clinical trials. In the last several episodes, we've come back to the Cognoscopy. Dr. Bredesen's evaluation is screened for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the important nutrient lab marker, vitamin B6. Next up, we're getting into vitamin B9, also known as folate, another very important B vitamin lab marker to keep track of. Okay, so how does folate relate to brain health? Well, let's first start with what we talked about on episode 38, homocysteine. If you remember, elevated homocysteine above Dr. Bredesen's target ranges is extremely inflammatory and damaging to our blood vessels, brain, and nervous systems, and is a strong risk marker for heart attack, stroke, and dementia. To prevent homocysteine from rising, we need our methylation cycle to run efficiently. And for this, we need key B vitamins, one of them chiefly being vitamin B12 and another being vitamin B6, which we talked about in the last couple episodes. The other vital B vitamin to the methylation cycle is vitamin B9, folate. So folate is an important cofactor for enzymes in the methylation cycle, but it is also necessary for normal red blood cell production, DNA synthesis and regulation, protein metabolism, helping the body break down, use, and create new proteins, cognitive function, the production of neurotransmitters, and especially for women during pregnancy, healthy neural tube development of the baby. That is, the healthy development of the baby's brain, skull, and spinal cord. This highlights how important folate continues to be to the vital processes in our bodies, especially to our brain and nervous system as we age. Symptoms of folate deficiency can present as anemia, fatigue, red swollen sore tongue, mouth ulcers, depression, confusion, irritability, nervousness, difficulty concentrating and short-term memory loss, psychosis, decreased appetite, indigestion and diarrhea, headaches and tinnitus, and progressive vision loss. Folate deficiency is no joke. Now, standard of care's normal blood lab range for folate is between 2 to 20 nanograms per milliliter. We'd typically be given a clean bill of health walking around with levels of 3, 4, or 5. But Dr. Bredesen doesn't want us to be at the low end of normal. Dr. Bredesen's team has seen optimal and improved cognitive function in patients with a folate blood lab range between 10 and 25 nanograms per milliliter. To go beyond normal and get our folate levels into the optimal ranges, we first need to know how deficiency can happen in the first place. Common causes for folate deficiency have been not getting enough in our diet, excessive alcohol consumption, and digestive dysfunction like Crohn's disease, celiac disease, and ulcerative colitis, causing malabsorption. Pregnancy. A pregnant woman has much higher folate intake requirements because the body uses up so much of it for the baby's development. This is a key nutrient to get plenty of and keep track of during pregnancy and after the baby is born. Genetic predisposition. Some of the population, including my father and myself, have genetic mutations that predispose us to folate deficiency, or at least that's the way standard of care has framed it. We're only at risk of folate deficiency if the right conditions are not met. I believe the better way to frame and understand this is that we have genes that make our dietary folate requirements substantially higher than the rest of the population. So, a diet in line with our ancestors seems to be what would be most beneficial. Please check out episode 27 for Dr. Bredesen's recommendations on healing the gut and improving digestive function. And also check out episode 16 for Dr. Bredesen's anti-Alzheimer's diet to cover all our nutritional bases. The current recommended daily intake for folate is 400 micrograms per day for men and non-pregnant women, 600 micrograms for pregnant women, and 500 micrograms for breastfeeding women. As a side note, for people who drink alcohol regularly, the RDI is up to at least 600 micrograms a day. That's how much folate your liver has to chew through to consistently detoxify the alcohol. So something important to keep in mind. A folate gets its origin from the Latin word folium, which means leaf. Folate, foliage. The highest food folate concentrations can be found in dark leafy greens like spinach, kale, romaine lettuce, and collard greens, asparagus, Brussels sprouts, broccoli, legumes like lentils and kidney beans, walnuts, flax seeds, avocado, beets, eggs, and liver. Because digestive dysfunction has become more prevalent and the average nutritional value of our food supply has also diminished, Dr. Bredesen also recommends supplementing with the activated methylated version of folate. The majority of folate supplements on the market are in the standard form of folic acid, which gets absorbed poorly and has to go through a couple enzymatic steps to be converted to the most active version of itself that can be used by the body. That active version of folate you can find as a supplement is called methylfolate. So to recap, Dr. Bredesen's optimal folate blood lab range for optimal cognitive function is 10 to 25 nanograms per milliliter. And since optimal folate status, typically with the help of B12 and B6, translates to improved homocysteine status, Dr. Bredesen wants us to check these lab values against our homocysteine levels, which should be between 4 and 7 micromolar. And I'd love to hear from you. Has your neurologist ever spoken to you about folate levels? What do you think about this video? Drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.